Hello. Thank you so much for coming. My name is Lauren Spigel. I'm a returned Peace Corps volunteer, and I'm so happy to be here with so many members of the Peace Corps family. We're so grateful you could all join us for this very special event. I served as a health volunteer in Nicaragua from 2011 until 2013, and it's really hard to believe that I've already been back for almost a whole year. Almost as soon as I got off the plane, I entered into an accelerated graduate school program at Johns Hopkins Bloomberg School of Public Health. It was a little bit of a change of pace from my life in Nicaragua, but I've adjusted and I have an iPhone and everything. And I'll finish my Master's of Public Health in May. I loved serving in the Peace Corps. It was an incredibly positive and enriching experience, both personally and professionally. For instance, during my service, I adopted a puppy who I brought home with me. Her full name is Mani Dalia Raptor Spigel, and she is completely bilingual. One of my favorite projects that I worked on in site was when I trained leaders from rural communities on how to facilitate talks on cervical cancer. And they also encouraged women from their communities to get Pap tests, and as a result, over 100 women were screened for cervical cancer. I was also a bit of a radio star in my community. I had a weekly radio show that reached the entire municipality, which was over 60,000 people. And I was able to use it to talk about themes that were considered somewhat sensitive, themes like women's health, domestic violence, and gender roles. And this leads me to the project that I'm most proud of. During my Peace Corps service, a group of volunteers and I co-founded a new program called ChatSalud, which translates into something like text health. ChatSalud is a mobile health project that uses text messaging to connect youth to sexual and reproductive health information and local resources. Before I go into this more, I want to give a full disclaimer about the project. ChatSalud is still in the development phase. Up until this point, we've been developing the concept, garnering community support, and participating in an iterative design process with contributions from experts in the field, as well as from young Nicaraguans who we hope to reach with ChatSalud. So now I'll go into the story a little bit of how ChatSalud got started. After living in Nicaragua for over a year, there were two things that were abundantly clear to my fellow health volunteers and I. The first thing was that there is a need for an anonymous way for youth to access sexual and reproductive health services. And the second very obvious fact was that everyone had cell phones. It's a fact that more people in rural Nicaragua have access to cell phones than to indoor plumbing. 90% of the population have access to cell phones. It's also a fact that in the tourist market in Nicaragua, you can buy paintings of men and women squatting on their latrines while texting on their cell phones. And yes, I have gotten a painting for each member of my family. Around the world, people are harnessing mobile phones to improve public health. Cell phones are powerful pieces of technology and can help organize electronic health records, keep track of the supply chain of medications, and in our case, cell phones can increase access to important information. In the small community where I was living and working, youth often face barriers when accessing sexual and reproductive health information. Some of the barriers include geography and socioeconomics, but the more pervasive barriers are things like embarrassment, gossip, and misinformation. As things are now, accurate answers to sensitive questions about reproductive health, safe sex, and personal wellness almost always require an uncomfortable face-to-face discussion with a nurse or a doctor. But not everyone is able to go directly to the health center for services. Young single women are especially at risk, because if they don't already have a kid or a husband, they're not supposed to have a need for family planning. In doing our work as Peace Corps volunteers, we found that people want information about sexual and reproductive health, but they want to do it anonymously, and I think everyone here can relate to that. So, working with fellow Peace Corps volunteers and our Nicaraguan counterparts, we developed ChatSalud to provide an anonymous means to access this type of information. We decided to use text messaging because it is the lowest common denominator technology. Everyone has cell phones and everyone texts, especially youth. One girl said to me once, "Texting is like my hobby," which I think sums it up pretty well. It's a fun, cool technology, and most importantly, texting is private. So, our text hotline, ChatSalud, will be the first of its kind in the country. The goal is to empower Nicaraguan youth to lead healthier, safer, and more productive lives by providing health information and connecting them to local resources in a free, confidential, and anonymous manner directly through their cell phones. The project is being carried on seamlessly by other volunteers now that I'm back. The original group of volunteers are all going to leave soon. They all leave in March and in April. But we've recruited a new batch of volunteers with a wide range of skill sets to continue working on the project. We're working with the Nicaraguan government to get the program off the ground and are also in talks to secure funding from a third-party donor to fund a full-time coordinator to ensure that the project is sustainable. Right now, we're running a mini pilot of ChatSalud with 25 youth in a rural community in northern Nicaragua. Some of the kids participating in our mini pilot have texted in comments that really demonstrate the impact that a project like ChatSalud can have in Nicaragua. For instance, someone texted in, "I used up all the money they gave us for ChatSalud very quickly because I don't have anyone else to talk to at night." Another person asked, "What do I do if my boyfriend doesn't want to use a condom?" And another participant added, "We don't have anywhere to go if we suffer violence." The efforts of the Peace Corps volunteers working on ChatSalud is showing that volunteers can mobilize coordinated efforts between partners at the grassroots and national level. For me, it's exciting that the new technology has not only connected our friends from our host countries, but it's also connected volunteers to one another. Volunteers are no longer isolated. Instead, they have a vast network of talented peers at their disposal. I believe that Peace Corps can use this network to make lasting change on a large scale. Really, this is what the modern Peace Corps is all about. With ChatSalud, we identified a problem at the grassroots level and had the flexibility, perseverance, and technological know-how to innovate a solution. My experience in Peace Corps changed my life and fueled my commitment to a career in public health. And the same is true for our next speaker. Although it has been many years since Carrie Hessler-Radelet served as a Peace Corps volunteer in Western Samoa, the lessons she learned in her community of service still guide her to this day. We in the Peace Corps family know Carrie for her warmth, passion for service, and commitment to every single Peace Corps volunteer. She is also a development professional who has dedicated her entire career to public health, with a special focus on maternal and child health and fighting HIV/AIDS. She has a clear vision for a 21st century Peace Corps that never strays from the core values that the agency was founded on, but is flexible and forward-looking enough to meet the challenges of today's rapidly changing world. It is my great pleasure to introduce Acting Director of the Peace Corps, Carrie Hessler-Radelet.